All right? So we got this here. Now, if you see this, this is the duodenum. This area is the here. This continuation of duodenum. All right? Now this is where your gallbladder releases the bile. Sometimes the stone is formed in this place. Now that's the time you put in the tube through your mouth, right? That's the question you ask. You put the tube in your mouth and try to take out the stone from here. All right? Or put in a stent so that the bile can be drained. Otherwise the person will have jaundice. Not in the colon. Colon is right in the out here at the bottom.
Somehow it got in the colon. Like, he almost died. Like, we didn't know what was happening.
No, he must have died. He must have not died. He must have got worse. Must have
The
got worse.
gallstone got into his colon somehow.
No, gallbladder will go to the colon if it gets released. Think about it. This is all intestine. Ultimately, it'll go into the colon. It'll go into your rectum. It'll go out. The point is that is not dangerous. That is not dangerous. Once it goes to the colon, means it's going to pass out. What is dangerous is when it is in the duodenum, at that area.
Okay.
That's the place. This place is the most dangerous where it gets caught.
Can it go into the urethra too?
No, it can't because this is the intestine. Urethra is a different pipe.
Okay, so why do people say they got the P kidney stones?
That's a kidney stone.
Oh, okay.
Not gallbladder
Not
stone.
gallbladder, but okay.
Not gallbladder stone. Right? So now I want you all to see another organ. Come on, get up. I want you to see. One of the most important, not one of the, I think really I call it the most important. You see this like this organ, this whitish thing, within the duodenum out here, right? This is called the pancreas, guys. This is the pancreas. All right, this is the pancreas. This is the one that produces insulin, and this also produces almost all the enzymes that help in digestion of food. Almost every enzyme is produced here. All right, this it is very difficult to find it. I'll try to clean it for you. Here it is, and this is the most dangerous cancer, pancreatic cancer, and causes jaundice and everything. Now you see, why is it dangerous? It is so deep. By the time the person starts having a problem, it almost spread. Yeah.
And so that's an overgrowth of cells.
Yes, overgrowth of cells, absolutely. So, and this is area, if you see, like a C-shaped, that's the duodenum. So, pancreas, gallbladder, and the duodenum, they open in one hole. They open together, and that's the place. All right. So we got this, and this, Ms. Young, this is your aorta.
Oh.
This is the aorta. If you can feel it, very, very hard. You can feel it. You can feel it. There's nothing dirty with this. If you guys want to touch it, yeah, touch it. Absolutely. It's very hard artery. It's a very, very hard artery. And see, it is. I can put a there. See,
And you said that's the biggest vein in the body?
biggest artery.
Biggest artery.
See, here is going. Now, in an artery, if this one now, you have a small little, what do you call that? Bubble. That's called a aneurysm.
Aneurysm.
Also you can, let me just plane it from here. Just plane it.
Need a suction.
My sister need to clean that out. Good job, Dr. G.
Here, look at this.
It's the doctor.
Here you go, right? So this is your aorta. And this is the, now you see, this is the wall, right? Now, in between this wall, if the blood is supposed to flow through this hole, right? If it doesn't flow through this hole, it goes to the wall. That's called the dissecting aneurysm. So this is your thing. These are your, what do you call? The intestines. So you got Now,
People eat that.
you got the esophagus? Yeah.
Chitlins.
The chitlins, right? The chitlins.
Thanksgiving.
Chitlins.
So you have,
People eat that.
yeah, so you have the esophagus, you have the stomach, so you have the duodenum, right? Then you have the small intestine, right? Then you have the large intestine, the rectum, and the AH.
I like the way you said it. Go ahead and say it one time. The what?
Say it again, Dr. G.
AH. So here is your chitlins.
Go ahead, Dr. G.
All right, so now you see some two other organs, two beautiful organs out here, right? These organs are
Kidneys.
their kidneys.
Look like baby.
They're found right in the back of the this thing, in the back. So these are two kidneys, and these kidneys are what shape are they? They're like a bean.
Kidney bean.
Yeah. See, it's so interesting that the botanists call the bean as kidney shaped.
Need to get some of that juice out.
If you really ask the person who teaches botany, he says, oh, the beans are kidney shaped, and kidneys are called as bean shaped. So here it is. Now if you see it again they're covered by a membrane. And so I'm going to clean the membrane, and there's a lot of fat here actually, because to prevent it. And
It smells.
this is
It's starting to smell.
starting to smell now. So here, now if you see out here, I'll show you something very nice. In this. All right. So you see out here, now this is basically what is the job of the kidney? The main job of the kidney is to expel the waste, right? Howsoever, another main job of the kidney, who will tell me? To basic. They already said waste.
It's a filter of the body.
That they said to filter out the waste. Something more important than that. Filter out the waste is small job of the kidney.
Does it filter the blood?
That's how it produces the urine, right? Filter out the waste. When you say filter out the waste, it comes, where is the waste? Waste is in the blood. Your nutrients are also in the blood, your waste is also in the blood. Of course, you have waste in the poop also. That's a different pipe. So the solid waste is there, but the liquid waste is in the blood. What else? Very, very important job. It does. It maintains your blood pressure. It maintains your blood pressure. All right? Like for example, if I have to ask you, what is the function of bones? What do bones do?
Big blood.
That's right. That's right. Makes your blood very, very important. So so those are some of the important things, which we normally don't hear of those things. So here, guys, so it basically produces, and where does the urine go? Urine goes through the no, it goes to the urethra, but before that there's a bladder. Before the bladder there is a ureter. Kidney to the ureter, ureter to the bladder, bladder to the urethra. Urethra is the final exit point. So if you see out here, see this pipe. See, this is the kidney, right? This is the kidney. See this pipe out here. This pipe, right? That is your ureter, right? And this will go to the bladder. This is your bladder.
Just a quick question. So your kidneys are located in the back, and whenever you have to urinate, so why do you kind of feel the pressure down? Because it done feel the what you call it in the
That's the bladder.
Okay, so the bladder's here.
See here, look at this. This is the bladder in my hand. The kidneys are coming. Your ureters are coming up
So
front.
we have tubes coming from here. Well, so we have like kidneys, and we have like tubes that's coming. Okay, right.
The tubes come up front, right?
And then that's why you feel.
Yeah, you can feel it. Yeah.
Absolutely.
Yeah,
And
you
why
can
is-
feel
and
it.
why-
And
why is
not only that, the easiest way, one of the easiest
Because-
ways to kill a person is stab
Right
here.
Right there.
Right here.
Well, thank you.
That's usually on the spot, so that is always, it sits above your kidney.
That's right.
What did you
The
say?
what?
When you boxing,
Yes,
They
absolutely.
tell you
Yes.
what covers?
hit above the belt,
What are
not
they-
below the belt.
Okay, I'm not supposed to tell you, but what are the nice places to kill a person?
They jugular?
This is one.
In the air.
Jugular,
And
yes.
then,
And-
well, I ain't gonna touch it.
Huh?
Uh,
Jugular, that's what
ju- oh, yeah.
Jugular. One of the easiest things to do is through your nostril.
So,
Oh,
Yeah.
yeah, that bone right up.
And push it
Yeah,
little
it
straight.
goes
Just take a
right into your
pencil,
brain.
ordinary pencil,
Yeah, just right up to you.
gone.
Dr. G.
That is terrible.
But it's
So
painful.
many
It-
levels.
It be out like a light.
Yeah, I knew
A
that.
little bit straight. Not a jail, a
You
little
just can't
straight.
do that.
I should teach a class, right? How to kill a person,
There's
right?
1,000 ways to kill
You
somebody.
got that TV show.
Yeah, I should offer one of those classes, right?
No, Dr. G.
One,
Be a disappear.
one,
You're a
of,
healer.
one of those dark classes.
You're a healer.
Yeah. So here, guys. So here it is. Now this is your bladder. See this? This is the muscle. This is the. Here it is. This is the
Oh,
bladder.
that little thing.
Isn't
so
it?
it's kind of
So
like
it's coming from
it
here.
inflates and deflates.
Yes, inflates and deflates. So urine comes, fills up. That is why, especially if you have a UTI, urinary tract infection or something, your pain is in the back.
Right.
But if you have a cystitis, that means bladder infection, then you have pain is in the abdomen up front, right? And if you have urethritis, then of course it is in the evacuation area.
So a urinary tract infection, that's inflammation of.
Urinary tract infection could be anything in the kidney, in the ureter, in the bladder, or in the urethra.
So it'd be bacteria that
It totally
has
depends.
entered your body.
That's right. That is right. And the normal reason for urinary tract infection or UTI
Not drinking enough
is
water.
mainly unclean sexual intercourse.
He said unclean.
Unclean. So please, men are dirty, nasty guys, right?
He said
Tell,
unclean.
tell that guy to go and clean himself, right?
Right.
You better go, what?
Yeah. Go clean yourself. And we
We don't want no UTI.
and we have a disease
So
called
they don't want to give us the UTI.
You gotta clean
No,
up.
You gotta clean yourself too.
and we have a disease called honeymoon cystitis.
What's that?
Honeymoon cystitis. Have you heard?
Inflammation of the honeymoon.
Not inflammation of honeymoon. Cystitis is inflammation of the bladder,
Yeah.
which happens during honeymoon.
So we'd be having
So,
too much intercourse.
too much intercourse and unclean because no
So
time
you
to clean
just keep
yourself.
doing that.
Keep doing it. Absolutely.
Y'all don't want to keep it G. They don't keep it G, y'all. Y'all don't want to keep it G.
So here it is, guys. From here to the ureter, then the bladder, and from the bladder it goes to the urethra, which is here, and poor guy's little penis out here. Right? So it comes out from the and
It hadn't
little
developed
peepee,
yet.
and this is called the urethral meatus. The final tip is called the meatus. All right, meatus. So that's it. We can. So this is the kidney. We can take out the kidney also.
My boy, no time.
Take out kidney, and of course we'll be doing all the dissections of the adult also. We'll be doing an adult kidney.
We have 2 kidneys.
Yes.
Some people have one because why is it? Yeah, I know they donated it or one is damaged. Why is it important to keep both? If some people can give theirs away, like I don't get it.
Say it again.
Why do some people? Okay, what's my question? The doctors say it's imperative that you keep both your kidneys, but if somebody needs to, you can give one away.
Doctors don't say that.
Okay.
No. Well, I don't know. You got a very interesting doctor who gives you vitamin D supplements.
You might need to change.
Yeah, I see now.
So, anyway, see the point is, remember one thing. You have got two. You got two because your body basically compensates for any kind of mishap that takes place, right? So, but in case you do donate one, nothing happens. The only thing is the other kidney enlarges or compensates. We call it